thank you for purchasing the wash stone with me as well as the oil. As I've explained to all of you who come to my practice or do a one-on-one on me outside of it, it is really all about when you do Gua Sha, about how your technique and about the intention, like being on the moment, concentration and relaxation mainly, and how you hold the stone. So technique is very, very important. So just as a reminder, there's two ways you hold the stone while you're doing it. So we always want to keep it flat towards the skin at a 15-degree angle. So it's like this, or like really close. I don't know if you can see that. Very close to the skin. You see that? So that is angle. There are very rare occasions where we are going to keep it at a 90-degree, exactly this way, and that will be occasionally depending on the knots and tension you're having on the jaw area. So that will be one where the position goes like this, and as you're moving, it's going to be on that way. Before you start Gua Sha, you need to make sure you have cleansed your skin properly. If you're doing this at night, I highly recommend to follow after cleansing with applying your serums and your creams, whatever treatments you're doing. And at the very end of your night cream, go ahead and apply your oil. When you apply oil, what you wanted to do is always have like moisten face with water or your hands. Make sure you're moistening. When you apply the oil and you massage it in, it will penetrate the skin properly and it will do its job a lot better. When you apply oil on dry skin, the effect is not the same, the absorption is not the same. Think of the neck as an ocean, and this area here where all our lymphatic passages and pockets are. The main ones, we have a couple around right on the front of the ear. We also have here small pockets in here around this area. This is a major one too, and they all flow through the muscle in this area, going outflow this way. So you want to make sure that you always start bottom and up, and I'm going to try to do a simple routine that will be very effective for that drainage of those toxins. A lot of people, when they will come to the practice, they'll feel that they have a lot of puffiness on their face, and the sagging, sometimes like the jewels that you see in this area look different, but that's not because that's their face. It's just mostly because that fascia, that skin with the tissue and the blood flow that we have is full of like these toxins and fluids that are with our tension and stress from every day. It just sits there and it makes us look all swollen. That's oftentimes the problem, and this is key to relieve that. So we always are going to start with the neck, because as I was saying before, think of this area like the ocean, and these are like the minor rivers, and everything needs to flow out this way. And whenever you are doing Gua Sha, you want to release all the main drainage areas first and then go up. So those are simple reminders. Always start at the base of your neck, where I do have this very protruding, this is just my aesthetics and arthritis I have on my neck, but at the base of the spine of the neck, and you will always begin, you see how I say flat, going all the way to the hair. The skin doesn't finish here, go over the scalp a little bit. It feels amazing, it makes sure that it relaxes. You could do any of these strokes between 3 to 6 or up to 10, depending on the areas that you are working. So you want to begin with that. Your next step will be to go ahead and do your same thing with the wider angle that feels most comfortable. You want to begin to relax this area here, all the way to the back of the neck at the base of the bone. So I'm going to go ahead and use this hand. Usually I use the same hand, and the pressure in this area can be sort of medium. You're going to do these strokes this way. It feels very good. Try to drink a lot of water after this, and after that you can also begin to do your neck. So just bring a little bit of blood flow, and this is light pressure, very light pressure. a little bit of blood flow in this area. I will always recommend to do one side of the face first so that you can see the difference to compare. I'm familiar with this and I usually do both sides, but that's what you wanted to do. So bring a little of blood flow to the base of your jawline here. When you're done with this area, you can always, this will be besides your eyes and the front here, since we have thyroid behind this area, and the throat, you need to be the lightest weight possible. So you're going to begin here at the base and lift up a little bit, and very, very gentle, very, very gentle, you're going to bring that blood flow up. So that will help you with the neck. A tip, this one has the roof, and this is what we want, the teeth. We want to do also a little bit of, and just you see this gliding up and down, up and down. It helps with blood flow, it helps releasing that fascia, helping with the wrinkles. So everywhere you feel like you need to like release some of those wrinkles, you can go ahead and do that gliding there. Now we're gonna do the lymphatic part of it, which helps to drain those toxins. We're always gonna begin, remember I had said behind the ear, we have those buckets. So a little bit of behind the ear flat, and you're gonna bring this down. Very gentle along the muscle line, and at the end, when you get to the clavicle, you're gonna do a couple of wigglings. Oftentimes when you do this, you're gonna start swallowing and you feel those fluids moving. That's when we are opening this area. Then we're gonna relieve the fluids around here, and same thing, you're gonna carry that over there. And I'm gonna repeat that movement, flat and extremely light, because the lymphatic pockets are very superficial on our skin. And then you bring that down. So generally the way I do this is I do a couple of pumps, then glide it, follow that curve nicely. Any of these movements are good for you. Once we've done that, we're gonna go ahead and do the double chin. This is amazing for double chin, and I might add too, for people who have acne, it's the best because you're releasing all those toxins that sit there. If you have an active acne, like I have one here, make sure, especially if they're really active, you avoid those. But as you start doing this regularly and releasing your neck and this area here are so great for acne. So remember that if you is that one of your concerns. So for the double chin too, you see how the stone is flat? You will always support the skin because you don't want to drag. I already applied my oil. You're going to support this here, and sometimes we feel a little bit of tension knots in here. You can drag them out. The pressure here is light to medium, and you're going to drag that all the way to the base of the ear. We're going to do the lip area. Just bring light to medium. This is going to help us with those jowls. As you see, I'm developing. I'm in my mid-50s. So you're going to go do that a little bit there. And make sure you also go all the way up. You are going to end at the ear area because we're releasing all those toxins all the way to those buckets in here. I'm going to repeat that. Holding the stone flat. Same thing around here. Curving, shaping. You could repeat that again up to 12 times if you want to. Sometimes you want to concentrate a little bit to these lines that develop here, training the muscle with a little bit more pressure. You could certainly do that, but remember, we're always releasing those toxins first. repeat that. A little bit more pressure in here, and then soft, releasing those toxins. And you could mix a little bit more pressure, but always releasing toxins. And when you're working different areas of the face, let's say we're working this quadrant here, when you finish with that quadrant, make sure you do at least 3 strokes draining down always, because you want that inflammation to go away, you want that to help. Now, towards the eye area around the nose, something that you can do too is here, this inflammation here, very light. You push that down, drag it out very lightly. Close to your eye area, never inside like the hollow area. It's like right at the edge of the bone, right here, all the way to the hairline, flat. This will help us with the dark circles, the inflammation along the eyes. We're gonna do that. Once you're done with that, remember we're talking about this. You can always, like if you have the crow's feet, brush them a little bit, kind of helping on that area or the edge of the stone. See what it feels best. You could use all the sides of the stone when you get familiar with the contours of your own face. But preferably, that's why I like the professional stones, because the angles are a little bit more comfortable and the teeth are better too on the stones. But that can help you too. And drain out. Now doing your eye area. You're gonna close here, always support the skin. And you see this angle here, you're gonna go ahead and gentle bring this out. That helps releasing the tension here, giving us that lift that we want. You can also use the comb a little bit right there. Comb that out. Make sure you bring it out. As we get closer to the forehead, you can definitely use this area for the forehead. If you have Botox injections, you want to wait at least 3 weeks and be gentle, very gentle in the areas where you have injections, because you don't want to spread the toxins of the injection and cause paralysis, the side effect, and you have to be very careful with that. When you do the Gua Sha, you can also do this area here. It feels really amazing. And you're gonna grab underneath your eye softly, and it's not pushing grab, it's just holding the skin a little bit. You're gonna go all the way up, working the blood flow in here. This feels so good. Same thing with the teeth. If you have 11s, you're gonna brush them a little bit, gentle, and brush them. If you have the horizontal lines, you can brush them horizontally and then wiggle it. This helps soften those lines. And make sure you're dragging everything out. And then we're gonna release all the toxins. Here's where we have those pockets. And just gentle. Bring them out. Very gentle out of here. Remember what I said in the beginning, this area here, your fluid, releasing those.